Happy Saturday, everybody, and happy holidays. It's Dr. Bridget Young from babyformulaexpert.com, and today for happy hour, well, first of all, I'm drinking tea, so it's not as super happy, but like all good Americans, I've overindulged the past few days, so I'm having some nice detox. And today, at an unconventional happy hour time, we are going to be talking about the freezer stash. Thank you for letting me do this at such an unconventional time. Both kids are supposed to be sleeping. One is sleeping. My husband definitely fell asleep trying to put the other one down. He's kind of wandering aimlessly now that he's escaped from bed, since my husband is fallen asleep in his bed. So he may pop in. Paul is passed out because the festivities are just far too much for him. So he's actually been napping great because he gets so overstimulated during the day. So enough about me. Today we're going to be talking about the freezer stash, and hopefully I'm going to be able to share some insights and maybe even some tips with you that are going to help you utilize your stash like a rock star. You be jumping Legos in the room. Okay, my notes are branded, we're going to call it. So before I get really into the logistical tips, I want to share a couple things that I think are really insightful about the freezer stash. One is that I consider the modern mom breastfeeding now as a breastfeeding triad. This is kind of a snobby joke because in research, I do breast milk research. We talk all the time about the breastfeeding dyad, which is of course the mom and the baby, and they make this team to breastfeed, and dyad means two. But for the modern mom today, it is really a triad. It is the mom, the baby, and the freezer, which often plays an equal role in actually feeding the babies. You know, sometimes it's from the breast, sometimes it's from the freezer if mom and baby have to be separated, which is everybody these days. So navigating that has become an integral part of every mom's life. The funny or not so funny thing is that the freezer stash, like if I said to you on the street, mom, like, oh, how's your freezer stash? They would know exactly what I'm talking about, right? If you have a new baby. Your medical professional may not. They will if they've recently been a mother, but if they, for example, are an OB-GYN that's been in practice for years and is out of like the child rearing game, they may not know. And it is such an integral part of new moms' lives. It's often a really big source of stress. Do you have enough, especially if you're going back to work? I know in that case, it's a source of stress for my partner when my children are young. Like, if you're leaving, do you have milk in the freezer for me to feed to the baby? So it's something that women really have to think about when they have a newborn and they may or may not be getting advice or direction from their healthcare providers. The reason is, in healthcare, we like to provide evidence-based recommendations for anything. Well, evidence has to come from somewhere, and people just aren't researching this, partly because it's happened so fast. Research moves really slow, so with breast pumps and everything that's available, that industry is moving much more quickly than the research is keeping up. So it's not like people don't care, but definitely the medical profession is far behind how quickly the evolution of infant feeding is happening in everyday life. So with that being said, the whole reason I went through that is I'm going to give you some tips, and these tips are my personal recommendations. I would call them evidence-informed. I mean, I have a scientific reason I'm suggesting these things, but we haven't studied this in medical research. So it really is like the Wild West of infant feeding, often called. Every parent is just trying to do the best they have with what they have available. And so with that being said, that is delicious tea. With that being said, these are some tips I have for your utilizing and prioritizing your freezer stash that will hopefully help you keep your baby as comfortable as possible, which is everybody's #1 priority. So if you're watching this and your baby is killing it, they're sleeping through the night, they're happy, you just turn this off. Whatever you're doing is working perfectly, so don't mess with the system you've got going. If you found me, that's probably not the case, and there's something that you would like to maybe improve with how your baby is feeling. And so hopefully some of these tips will help you, especially if your baby's in that very newborn phase. So the first tip is one, Remember that the freezer stash is for the baby, which is such a stupid thing to say. Obviously, you know that. But sometimes how we act in thinking about the future, it doesn't always play out that way. Sometimes we make decisions to prioritize the freezer stash, thinking about future needs. And it's my opinion that we should always think about prioritizing the baby, especially if in that given moment, formula is your next option. So, for example, mom has an illness, mom has an unexpected business trip, mom has anything that's going to cause her to be separated from the baby. And so the normal routine of how she's providing milk isn't going to be enough. And so they have to make the decision of, do we save the freezer stash for future, because we know we're going to need it in the future, and do formula now so that we know we have at least some to keep providing breast milk in the future, or do we use the freezer stash quicker than we thought? My advice is almost always use it now, because if your alternative is formula, especially formula for the first time now, definitely use the milk. 2 reasons for this. Breast milk is most beneficial for the youngest babies. When their intestines are less mature, so all those hormones are absorbed right into their bloodstream. When they're, the less mature they are, the more maturing they have to do. So the benefits of breast milk can be more exaggerated the younger they are. So it's always better to feed it now at the risk of having to feed formula later, especially if that means you're going to have to feed formula now. Very circuitous words I'm using, so I hope that point comes across. Another example of how I get this question a lot is, okay, I've had to stop breastfeeding for whatever reason. I have this huge freezer stash. Is it better to just use it up now, and then I probably have enough to get my baby another 2 months before I have to feed formula, or I have enough to do 50% breast milk, 50% formula all the way to a year? Which is better? My answer is always, use it now for all of those same reasons. The baby has more potential to benefit, for lack of a better phrase, the younger they are. So use it now, and then I would say delay introduction of formula and save yourself a little bit for when you introduce formula, that you can do it gradually, that you don't use up your last bottle, your last bag of breast milk and then cold turkey to formula. Hope that makes sense. If it doesn't, leave a comment and I'll come back and try to work on how eloquent I am. So that's what I mean by prioritize the baby over the freezer. 2, second tip, mix as much as possible if you are mixed feeding. So if you are already providing formula and breast milk together. Classic example, your baby goes to daycare, you send 4 bottles, you're 50-50. It is, again, my opinion, much easier for the baby and can provide significant comfort to provide 4 bottles that are each half formula, half breast milk, as opposed to 2 bottles breast milk, 2 bottles formula. The exception to this is if you are using a reflux formula that's thickened, so like Enfamil AR, and that's because the digestive enzymes in breast milk will digest the starch and the formula will not thicken. The pro to that is if you're not using the thickened formula, the digestive enzymes in the breast milk will help the baby digest the formula. So it's taking advantage of as much of the breast milk properties as we can. So mix as much as possible when you're utilizing your freezer stash. 3, note the time of day that you pump. So when you're freezing your milk, note the time of day, because breast milk changes a lot over the course of the day. A very brilliant research lab recently published about how breast milk insulin increases over the course of the day. And this is probably because you or everyone's adults insulin slowly increases over the course of the day. So it's probably just reflecting mom's insulin. But changes like that are happening in a lot of hormones in breast milk as the mother goes through her day. And that's a way that mom helps communicate to her baby diurnal rhythms. We are awake during the day. We are asleep at night. Like that thing we're really trying to get our newborns to grasp, the difference between day and night. Breast milk helps communicate that signal. I can hear that my husband is falling asleep. Oh no, he's awake now. Can you hear PD? I need help getting off the potty. I'm not leaving him there, someone's coming. So the point being, if you have enough breast milk to help match the time of day, go ahead and try. If you don't, mismatched breast milk, like milk pumped in the morning, fed at night, is still better than formula. So don't, if you can't match up the times of when you're feeding, don't stress about it. But if you have enough breast milk in the freezer and your baby's having a hard time learning their nights from days, falling asleep at night, etc. That's a really easy tweak that you can do that I've seen make a big difference for some babies. Some babies are more sensitive than others, you know, some babies, every baby is their own little person. But that's something that you can start thinking about if your baby is having a problem learning the difference from napping during the day and sleeping long stretches at night. So note the time of day. 4, note the time of feed. By this, I mean, are you pumping hind milk or fore milk, or are you fully emptying your breast? So mamas that are trying to increase their supply or have really engorgement issues, so it's very common, after you nurse your baby, your breasts are still very full, or you're trying to get extra stimulation, so you pump each breast after your baby has nursed at the breast. Whatever milk you're getting from that pump is hind milk. So it's going to be really high in fat and lower in protein. Alternative example that's very common, my mamas with a forceful letdown reflex and maybe an oversupply. So often those mamas will pump for 5 minutes before they nurse their baby, so the baby doesn't have the waterboarding effect. Well, that milk that you're pumping, that's all fore milk, the first milk from the feed, which is very high in protein and very low in fat. And if you put these in the fridge, you can visibly see the difference. But if you're just throwing it in the freezer and you don't label it or you don't know, obviously those are digested very differently and they can have different effects on the baby. Breast milk fat increases as the day goes on. I personally think this is so that at the end of the day, baby's getting really fatty milk, which will hopefully help them sleep longer because it may have more calories. And the fat helps their blood sugar remain more stable, which will hopefully help decrease night wakings. So with those in mind, if your baby's having some of these issues, you can take advantage of knowing if it's fore or hind milk for a lot of different reasons. One, if you've got a lot of hind milk available, saving that hind milk for the top off bottle before bed might be a really great way to get your baby to go a longer stretch. Or alternatively using fore milk earlier during the day when you don't mind if they are awake longer. Noticing some babies, really sensitive babies, have a hard time with a full bottle of fore milk because it's a lot of protein. So notice if you feed it to them, they are really uncomfortable afterwards. Well, then maybe mix fore milk with hind milk or another, full breast expression so that you're diluting the protein a little bit. So just noticing how the baby responds can sometimes help clear up a little bit of previously inexplicable discomfort. If your baby's one of those kiddos who needs a little bit of breast milk fortification, if they're having trouble growing, a lot of pediatricians, will add a little formula powder or, do things to try to increase the calories. Well, if you're lucky enough to have a lot of breast milk in the freezer, especially a lot of hind milk, ask your doctor if you'd be okay thawing the milk and then letting it sit on in the refrigerator or on the counter for a little bit so you can see it naturally starts to separate. And then you can scrape off the fat or just pour off the top portion, which will be really creamy, literally cream, and use that as a fortifier. So really taking advantage of being able to use as much of the breast milk as possible and limit as much formula as possible if that's an option for you. So utilizing fore versus hind milk strategically. Yeah, hit all those. 5, making special exceptions and special decisions when your baby is sick. So if you are a breastfeeding mommy, when your baby is sick, your body responds to your baby's infection, which is pretty badass. So they've done really cool studies where they've noted when a baby is sick, mom's breast milk responds with higher antibody concentrations, actual live immune cells from her own body in the breast milk that then help the baby recover. The other thing is we know that moms make antibodies to their environment, which is usually the shared environment. So say your baby gets the flu or something and you don't get it because you probably are immune. Your body is making the antibodies to what your baby needs because you are both exposed to the same germs. The whole point of that is when your baby is sick, try to prioritize feeding your baby fresh milk, meaning milk that hasn't gone into the freezer. Because you do lose just a tiny bit of properties when it freezes, like not enough that I want you to stress about it all. But when your baby's sick, let's try to give them every little opportunity to recover. And try to prioritize milk that you have pumped that day. So I know a lot of moms, myself included, when you go back to work, you get into this rhythm of pumping, and sometimes you pump, like I had a freezer at work, so I would pump and immediately freeze it, and then at the end of the week, I'd bring home all my frozen milk and then kind of be turning over my freezer stash so I never had to throw any away. Nothing wrong with that. That's awesome. If your baby is sick, I recommend interrupting that routine so that you're feeding them the milk that you pumped that day or the day before. Because again, that milk is going to have immune properties likely tailored to the infection that they are fighting. So let's give them every chance to be able to overcome that quickly. So when your baby is sick, making special efforts to feed them fresh contemporary milk that you're pumping like really as close as possible to the same time. 6, oh yeah, noting the dates. Everybody usually dates their breast milk bags, but noting dietary changes. Lots of breast milk moms go through slews of dietary changes to try to help their baby be more comfortable. Just make like your phone has a notes app. Just write it down. That's all it needs to be. Like, gave up dairy the day after Thanksgiving, so that like by the time hopefully you finally figure out what's causing your baby to have that rash or to be so fussy, you have that date of when you gave it up. So dairy is a huge one. I personally had to give up dairy with Vaughn, and it was life-changing for him. And thank God, I didn't write it down, but once we realized it was such a big deal, I went back and like drew X's on all the milk that I had pumped before that, because it was such a big deal that we didn't want to inadvertently re-trigger him by feeding milk that I had made when I was eating that trigger food. Babies outgrow that stuff. So when they're 6, 7, 8 months old, you can feed them that milk again. It's not like it's wasted. But when they're really little and still sensitive, if your baby's one of those sensitive kiddos, being sure you note the dates of your dietary changes will help you avoid inadvertent triggering by feeding milk contaminated with whatever dietary thing they're reacting to. Okay, that's pretty much it. So the very last one is try to get into the habit of when you're pumping and freezing milk, just adding a little bit more detail to the bag. Everybody dates, but I think the minimum that we should be adding is time is great, but at least AM, PM. So lots of moms try to build their freezer stash by pumping one or both breasts first thing in the morning when you're generally much more full. Amazing. But that's morning milk. So if your baby's really having a hard time falling asleep at night, maybe try switching their top-off bottle at night to something that you've pumped at least in the afternoon, as opposed to in the morning when you've got all these hormones telling your body it's morning time. We would like hormones telling them, go to bed. So on your breast milk bags, note time of day, or at least AM, PM, date, and then, for milk or hind milk, you can just F or H if that's relevant. If you're doing a full breast expression, meaning you're completely away from your baby, you're on the pump, you pump till your breasts are empty, you're done, you freeze it, that's got it all mixed together, so it's not one versus the other. So, but noting that is, I think, very helpful. So in summary, to use your freezer stash like a badass mom, these are some tips to help. 1, remember it's to prioritize the baby over the freezer, meaning I think it's always better to use up the freezer stash as opposed to prioritize stretching it out. Talk to your doctor, of course, these are just my suggestions. 2, mix as much as possible if you are mixed feeding. So mixing formula and breast milk together as opposed to alternating between breast and formula feeds if you're feeding in the bottle. 3, note the time of day, because hormones in breast milk will mirror mom's hormones, which means hormones that have a diurnal variation are going to have that pattern in the breast milk, and we'd love to be able to teach baby night is night as early as possible. Note the timing of the feed on your bag. So if you are pumping either fore milk or hind milk, noting that will be helpful, because you'll just be able to note how the baby's responding and then hopefully be able to utilize those milks strategically to help everybody get more sleep. 5, when baby is sick, do your best, don't kill yourself, we're all just doing our best, but do your best to prioritizing providing the baby fresh milk, so meaning milk that has never gone into the freezer, that you have pumped recently. So in the time that you have likely also been in contact with whatever bug has made them ill. And 6, noting the dates of your dietary changes, if any, somewhere in your phone, anywhere in your house, so that you can reference, so that if you figure out something that you're doing differently that is helping your baby, you're able to quickly go into your freezer and take out all the milk from beforehand and set it aside for when they're 8 or 9 months old. And that's it. I really, really hope that is helpful. Being a new is really hard being any kind of new mom. Even if you're a stay-at-home mom, you are working your ass off, and every mom is worried about her freezer stash because God forbid you have to go to the doctor alone. What if you want to go to the OB without the baby? You have to have milk available. It's so stressful, and as I said, the advice that you can get from your medical professional is very limited because we don't have research to inform how we're advising women on these topics. So I really hope this is helpful. If there's other questions you have of stuff that I totally skipped over, which I'm sure happens, leave it in the comments. Give me like 5 days to respond to it because holidays and exhausted. But I will get to it. I hope you guys have a wonderful holiday. We did have an amazing Thanksgiving. You're keep coughing. I'm worried he's coming down with a little something, but such is life, and it's that time of year. So everybody, please enjoy the rest of your holiday. Be safe. Enjoy your baby snuggles. Make your gratitude list, and I will see everybody next week. Thanks so much, guys. Bye. Sign on graceful accent. I tried. Okay. Bye.